Roundtable discussion, great stuff. And hopefully Sven will help me with the questions, or already we have enthusiastic questioners. So Gonzalo, if you can share the microphone. I knew the audience would not be shy.
Oh, those lights are bright.
¿Estamos listos?
Esse é o sujeito que faz uma pergunta de 10 minutos.
Please say who you are, where you come from. Por favor, preséntese y haga la pregunta en inglés o en español.
Buenas tardes. José Miguel Doporto, profesor todavía de la universidad, pocas horas, pero más trabajo en campo. ¿Qué relación tiene en los sistemas de producción en los Estados Unidos la cohabitación de cerdos de diferentes sitios 1 hacia sitios 2 y la aparición de estas cepas extremadamente patógenas?
¿Puede repetir la aparición de...?
La aparición de estas cepas patógenas.
Pero con...
o hiperpatógenas.
Sí, ¿en relación a qué, perdón?
Cohabitación. Commingling of pigs of different farms.
Good. Hopefully...
If I understand, the question is, where does this virus come from, right? Long story short, and we see that most of the viruses we see in the US, the emerging ones, not only those high pathogenic ones, any virus, they tend to come from grow finish, and so and it makes sense because that's where most pigs are, and a lot of lungs, a lot of situation that favors the viruses to emerge. Unfortunately, in the US, Clayton, correct me if I'm wrong, but in general terms, there's a lot of shared still labor, right? Especially in high dense areas. So you have one service person visiting 6, 5, 7, 8 farms a day. And so in that situation, if you have viruses in grow finish, that it helps, that situation helps for those viruses to find the same pig, the same, and then replicate and recombine, so on and so forth. So we see in the US, my perception is that it comes from those situations of grow finish pigs, especially in those high dense areas where you have a lot of epiconnections between them.
Well said. The pigs in the U.S. are where the corn and the packing plants are, where the slaughter facilities are. That's the lowest cost to raise the pigs. And so even if you don't commingle the pigs from multiple sources in one site too, you are commingling your PRRS strains. Because this site has one PRRS strain, this other site has another PRRS strain. PRRS moves through the air very effectively. And even if we have great biosecurity for the people, if we don't mix the pigs, we still see the viruses mix very commonly.
Yeah, I'll just add that that's probably one of the major area of concern, but there are others which, for example, there is one of our colleagues at the university that is doing some research with live virus inoculation material, and he's finding that sometimes those have multiple viruses present. So that's another opportunity for virus to be recombining when you're injecting, that sample in multiple pigs, and that you're going to go there and meet other pigs potentially down the road. That's another potential way that those viruses will have to recombine. So it might not be only happening at the grow finishing herd, but it's definitely being amplified there.
Mm-hmm. I think the other factor that I think your group and groups in Spain have looked at is also the management of mortality. You showed us in Denmark, this is a potential weakness there. I think that's an area that's often forgotten, right? How the rendering truck is moving, how we move deads out of the farm, and what do those people do when they come back in.
Definitely, yeah.
I see that as a huge risk factor for area spread beyond airborne area spread.
First PD and others.
PD, Brachyspira, you name it. Yeah? APP, yeah. Great, thank you for the question, gracias. Una pregunta en castellano. De las granjas que se volvieron negativas, ¿hay alguna que regresará a ser positiva? ¿Y cuál fue la razón? Creo que esto es para Dinamarca. The question, Peho, I think is maybe for you in Denmark. of the negative farms, the farms that you made negative or naive, did some of them come back to being positive, and what was the reason?
Yeah, certainly. Some of them, some of the ones that were eliminated, they become positive again. Some of them, actually, I think they were not truly negative. So we've seen in some cases that probably they were testing too little, and they were not really truly negative. They were testing too short or taking too few samples. We have seen, for example, that in according to the regulation, when you put in sentinels, you should just test them 4 weeks after placement and then 6 months later. Of course, a lot can happen in between there. So recommendation is always to test monthly at least. And the other thing is that sometimes you see that some are testing, they've been testing once a month maybe, so due to wean pigs, and based on that, they think that they are actually negative. They put in sentinels, the sentinels become positive, and that's because when you have a very low prevalence, it will not be all the batches that are positive. Maybe you will just have one every 5th week that are positive. And if you don't find that one and you then assume that you're negative, then you fail immediately when you put naive sentinels there. Mm-hmm. Then others are getting reinfected actually from neighbors. So that's what I said, that if you are in a very high risk area, so in these areas, it's not only the sow farms that are the major threat there, because they have a very, very low shedding of virus, even if they're positive. But from the nursery, you can have a lot of shedding, and especially from the finishers. And somehow it happens that most of these areas where we have this high density of positive farms, that's also where we have a lot of finishing farms. And there's a lot of virus coming out of these. There's always a discussion again, should we vaccinate piglets or should we not if we are going to be positive? But there's, you would say there's two reasons for vaccinating piglets. One is to protect your own pigs. If they're going to meet the PRRS virus later on, of course it's a good idea to protect them. But we also know that we reduce the length, the duration of viremia, and the amount of virus that are excreting. So by vaccinating the piglets, you're also helping your neighbors or lowering the risk of getting an infection. And we definitely see transmission from some of these finishing herds to naive sow herds by airborne spread. We know it for sure. We have seen, for example, sometimes some are doing stupid things, you could say. We've seen nurseries that are close to be negative, then you have some of the older pigs, they are positive still. Then they say, okay, now I do a depup of the rest. I move them somewhere else.
Yeah.
Well, if that somewhere else were close now to into a negative herd, we have seen that a couple of times, and they blow up. So you actually made things much worse than in just wait until they are in a safe place. Get them slaughtered or get completely rid of them. Don't move them to a very vulnerable site.
Typically what you do is you sell them to Poland.
Yeah, that's what we recommend. Not what, but but this is so we definitely see airborne transmission. We have some proofs of that.
Yeah, even with type 1.
Yeah. So that's two main. They become reinfected because they get it from the area, but it's also very often because they actually did test too little before they decide to go to the next.
In the US, rebreaks, airborne introduction would be a big risk factor, Clayton?
Absolutely.
Yeah.
There's lots of different risk factors, but airborne is going to be right up there. And I think with a breeder farm, that's where whole genome sequencing is valuable. So you can try to understand, is this a new introduction of virus? Is this a recombination of multiple wild type strains I've had on the farm? Or is it simply the old virus we've dealt with and we weren't truly negative when we brought those gilts in the herd? But without the whole genome sequence, it's really hard to answer that question.
Good. We can, because we have so many questions. We will have another roundtable in the afternoon. Tendremos otra sesión por la tarde para responder preguntas con calma. O si no, poder hablar con los ponentes. Question from, not anonymous, from Ryan Tenbergen. I hope I'm pronouncing that correctly. Okay, yeah, please go ahead. I can't see with the light right in my face.
Buenos días.
Buenos
Soy
días.
Álvaro Herrera de Guatemala, soy productor de cerdos. Mi pregunta es, ¿puede un animal vacunado contaminar una granja que nunca conoció el virus, que toda la vida ha sido negativa, al ser un virus vivo modificado?
I think I
The question
understood.
is, MLV vaccinated pig could, the answer is yes,
Yes.
right? Because it's a
Yeah.
replicating virus and it could spread.
Yeah. So, a very short answer. If you're naive, you're naive. If you have vaccine virus, you are no longer naive. The vaccine is a replicating live virus by definition. And we would not recommend vaccinating particularly pregnant animals with modified live because you will see transmission to the fetus and potential pathology.
And there was a question on vaccinating naive herds. So I'm gonna jump ahead of that
Yes.
and then put Clayton in the spot because we did a study with him and he was kind enough, right? That ended up being published, right? So people are interested. Clayton vaccinated a naive farm because the pressure of infection, Clayton, I think it was mounting, right? And so what was observed in that situation was, I think we guys detected virus for up to 14, 16 weeks post, right, in processing fluids. But in terms of clinical impact, there was a short transient spike in aborts and mummies and so on and so forth for a couple of weeks. And then the herd kept on that stable scenario, vaccinating, and then no changes in productivity in subsequent infections. Clayton.
You described it very well, and in that herd we intentionally vaccinated, so it was not a situation where we had a transmission of a vaccine-like strain, which is possible, but it is generally very rare. When we sequence outbreak strains in the U.S. at least, it is possible to find an MLV-like strain, but it is a rare occurrence when we do find it.
Great roundtable discussion. Reed, do you want to add anything to that? Or?
I ditto what was just been said, and I'm thinking of a couple publications actually. Dr. Paul Yeski, that was a question I think he and his colleagues wanted to ask and answer as it regarded, what can I do, what should I know, and what can I do as it regards managing a vaccine virus where we want to vaccinate wean to finish sites that might be in close proximity to a naive breeding herd. And so they would study that with a modified live, our vaccine, or the BI vaccine, and then subsequent modified live vaccines. They would vaccinate what they have as a research wean to finish barn, and then try to monitor the amount of vaccine virus shed from that vaccinated population over time and over distance. And to your point, the vaccine virus is shed within and from the facility, but at a rate much less than wild-type virus and very manageable. And I think in the 2 or 3 studies they did with different modified live vaccines, that period of time was, 2 weeks post-vaccination. I mean, I would say 3 to 2 weeks post-vaccination is just negligible amount of vaccine that they could find outside the facility. So it's possible, but again, to your point, Clayton, it's the risk is manageable and it's low.
And it's not primarily aerosol, at least with Engelvac MLV. Scott D for years told everybody that aerosol wasn't possible.
Yeah.
And he said it wasn't possible because he was using VR2332 for his trials, which is the predecessor strain of Engelvac MLV. And so in controlled research, no one has been able to make that strain, the Engelvac MLV strain, transmit via aerosol. Via fomites, absolutely. Via infected pigs, absolutely. But via aerosol, I would say for the Engelvac vaccine is not a big concern.
What was, to that point, I'm getting old, but you made me remember something. that same Yeski study that I'm describing, it was a wean to finish facility where he had a vaccinated room, 1,000 pigs on room A,
Yep.
and 1,000 non-vaccinated pigs,
Naive,
room B.
right next to them.
Right next to them.
And they raised them without getting them contaminated,
Yes,
right?
that's right. And just and
No
common
air filtration.
No air filtration. Common sense biosecurity.
Yeah.
The people that serviced and cared for the pigs just used common sense biosecurity between the vaccinated and unvaccinated group, and never had transmission of vaccine virus to room B.
Yep.
Never.
It's manageable.
Yeah, it's manageable.
In fact, Reed, you may remember we had an experience when you were my tech support when we were doing an elimination, and we found we did move vaccine virus from one barn to another in a nucleus herd, if you remember, but we realized people were snaring pigs, expected positive pigs, and then using the same snare to catch pigs in the expected negative population. So this is a long time ago,
Yeah.
we learned that oral fluids on a snare are a very good way to move virus around. So we've learned a lot in the last few years.
I could go on. Now you're making me think of more. The old mass vaccination unidirectional flow studies, where we would take an endemic continuous flow wean to finish site, okay, and mass vaccinate, close it for a period of time, and just for a period of 8 weeks, at least 8 weeks, divert pig flow. So it's kind of closure and mass vaccination, then unidirectional flow, the positive infected vaccinated pigs out. We could create that bubble and have, after 8 weeks, introduce naive pigs right into that same site, maybe a barn away or rooms away, from positive animals that have been mass vaccinated, and just common sense biosecurity. We know what to do. We just need to do it. Common sense biosecurity between the two groups. Never move vaccine virus from the vaccinated site to the, or vaccinated pigs to the non-vaccinated pigs, as well as wild type virus. So a lot can be done, as good stewards relative to managing vaccine virus and minimizing its impact that way.
I'm going to stop you and connect it to the question that I was trying to ask from Ryan, because I've put him in tenterhooks. So this question, how do you decide when to not use MLV vaccine in acutely infected herds? Or, and I don't know, maybe it's not the same answer, in low prevalence herds. The question is really related to this potential impact of vaccine recombination with wild type, which has been talked a lot, and I know the panel have strong opinions on this, so I don't know who would like to answer. Maybe Marius, do you feel comfortable jumping in?
Exactly. So when let me start with low prevalence scenario. I think the ideal scenario, this is what I depicted here on the chart, is that we are 3 to 4 weeks ahead of vaccination. I understand. Challenge, yes. That with the vaccination, we are 3 to 4 weeks prior challenge, so that the pig has enough time to build up immunity. I also understand that this is not always the case in the field, particularly when we have a low prevalence scenario. Then we give birth to PRRS positive pigs, and they get vaccinated even after they had a wild type challenge. So this is a scenario that we see all over the place. In these scenarios, it's very important to vaccinate the piglets, and the potential threat of recombination would be not of my concern. It would be a bigger concern that we know from Daniel, that a lot of the systems that are not only breaking with one PRRS strains, that are breaking with 2 PRRS strains, and recombination is not a vaccine feature, it's a PRRS feature. So this will happen anyhow in your system. The best way to control it and to avoid recombination is to apply piglet vaccination. So don't leave PRRS anywhere to go.
Right.
Build up immunity in your pigs and stabilize your sow herd, so that on long term you are able to give birth to PRRS stable to PRRS negative pigs, and then you are already 3 to 4 weeks ahead of a challenge with a vaccination protocol.
My answer as well. So if you have very short. If you have a really acutely infected farm, and you maybe see the first clinical signs with the sizes of farms we have now, there will always be sows or piglets that are not infected at that time point when you find out. And then it's important to give that immunity to them as fast as possible. So as immediately we know that we identified a farm that has broken, and we know it will be bad or not be bad, we would do the mass vaccination of all the rest of the animals to stop the infection from moving on. And doing that, we also know when the clock is starting. So if we don't do anything and just leave the virus to find its own way around, it can take weeks before the whole herd is infected. And you don't know where you are. So Daniel showed this, after 6 weeks, you can expect that some mummies are showing up. And so we have these steps. This we can follow. If we do the mass vaccination immediately, then we know when we stop, when the clock starts, what we can expect of the different phases, when we can expect to go negative. So just waiting, it's putting the rest of the herd as a high risk.
At risk.
One quick data point before we can talk about some PCV, hopefully, right, is in the US we have this program called the POMP, short for PRRS Outbreak Management Program, and we follow those herds post-outbreak, how did they respond to the outbreak, and then time to stability and piglet losses. And long story short, for that particular question, the quicker they establish the load close exposed and they start the herd closure program, the quicker they're gonna get to the end point.
Yeah.
If they wait a little bit, I'm gonna wait the herd to cool down. All right, your closure might be shorter, but you're gonna take much longer to get right to that stage where you produce negative pigs, and then the cumulative losses is gonna be proportional to that. So just that data point.
Very good answer. I think we do have some data from type 1 data where we vaccinated batches on a farm that we were tracking very closely, and the first batch had 30% positive piglets, and there the results were not as good. The next batch had a lower prevalence, the sow herd was stabilizing, and there we saw very positive performance already when the prevalence was still there, but was at a lower level. So I think these decisions may be almost farm to farm, depending on where you are and what your objective is at the end. The key is understanding the status of your farm, and that's where those population monitoring tools that we have now make it much, much easier, right? We can understand where we are. Do we still have sow herd stability, instability or not? So great answers, gracias. We're going to move, before we go to the continuing PRRS question, I think we'll do a little bit on PCV2. So this one, I believe, is for Marcelo. Casi todas las muestras que enviamos al laboratorio salen positivas para PCV3. Sin embargo, no vemos problemas en el campo. Tengo la impresión de que quizás estamos poniendo demasiado enfoque en este patógeno. So the lab, I'm detecting a lot of PCV3 in my lab submissions, and I'm wondering, the speaker says, if I'm not seeing clinical disease, so I'm wondering, are we putting too much emphasis on this detection of PCV3? What's your opinion, Marcelo?
Yeah, we see a lot of detection of PCV3, and I have a slide somewhere that shows that we see more PCV3 detection than we see PCV2 if we compare different sample types, right? Like 60% of the samples that we test are positive for PCV3, 40% of the samples that we test are positive for PCV2. So detection, a lot. Like, can we put any meaning to it? That's very hard. Like, there isn't like a clear case definition for disease associated with PCV3 post-weaning. There are some clear lesions that we can see that can happen when PCV3 pigs are infected with PCV3, and then we can show the PCV3 in lesions. But when we try to track that back to specific clinical signs that those pigs have, that we haven't been able to do that yet. No one has been able to do that, to put PCV3 in pigs and associate with a clinical disease in pigs post-weaning. There is a little bit more evidence for reproductive disease, but still early days to really try to understand what could be happening there with PCV3. So yes, I think there's a lot of emphasis, a lot of concern with PCV3, and if you are finding it, my advice is to really dig deep into your diagnosis and to try to correlate with clinical performance, right? If that's the case here that you're detecting, but you're not able to find it, any clinical issues associated with that detection, yeah, I would not be concerned with it at all.
Gracias, Marcelo. The good news, our time was up, but we have managed to find more time, and we will continue for another 15 minutes. So, well, now 10 minutes. Estamos a final de nuestro tiempo, pero vamos a extender 10 minutos porque hay tantas preguntas y tanto interés, pero os aseguro que volveremos a comer en un momento. Another question coming up on, well, any on the floor? ¿Alguna pregunta desde la audiencia? ¿No? Que no veo.
Gracias. Víctor Quintero, de aquí de México, consultor. Una observación que tenemos aquí sobre los brotes de PRRS de alta virulencia, que también tenemos bastante de este problema, es la caída de la inmunidad en la línea de producción. Casi siempre nos enfocamos mucho al tema sitio 1, pero la línea de producción es donde tenemos el impacto mayor. Uno de los efectos que estamos observando es que los cerdos vacunados contra PCV2 después del desafío de PRRS pierden en gran medida la capacidad de defenderse contra PCV2. La pregunta es si en Estados Unidos están utilizando una segunda dosis de PCV2 después del desafío de PRRS para restaurar esa respuesta inmune, que es lo que estamos encontrando aquí como una posible solución.
So hopefully that was translated. The question is around a topic that's real, which is co-infections, particularly with this high pathogenic PRRS strains. We go to vaccinate then with routine vaccines like PCV2, and we see a lack of complete immunity. What's the situation in the US? How do people deal with this? Do they use a second dose of PCV2 vaccine? I don't know who would like to answer. Maybe Clayton, you first.
I think it's a common problem, whether it is PRRS or any other comorbidity, co-infection. Pigs that are sick, pigs that have a fever, pigs that don't eat, they are not eligible, good candidates for vaccination. Whether it is PCV2 vaccination or mycoplasma vaccination, any of the vaccines we give. Our problem with pig vaccination is we vaccinate 100% of the pigs at the same time. And we do it when they are healthy, and only 1 or 2% of the pigs are not good candidates today, and we keep doing it that way when they are sick, and only maybe 70% of the pigs are good candidates for vaccination on that day. So I think giving 2 doses of PCV vaccine to the population is our only solution in that situation. A lot of times in the US, the second dose is given more as a rescue dose, not as a program dose, as a, oh no, these pigs are 10 weeks old, I see clinical signs of PCV2, I'm going to give another full dose of vaccine. And I actually see very good response with that. I see the pigs respond to the second dose very well, almost as a treatment. I can't explain exactly why, but it's been very effective in my experience to do that. We will also see some producers delay the PCV vaccination a little bit. To me, that is very risky. Yes, you will have some of the lower viability pigs die before you vaccinate them, but the pigs that are getting infected with PCV2 before the vaccination, they won't respond very well.
I will add that, and I know that in Mexico, PED is on a surge right now. Certainly from our experience in Asia, when you are in a PED situation, we see a similar response. Those pigs may be looking recovered, but they don't have the capacity to respond to the vaccine like we would expect. So again, that could be another scenario where you have to look at your vaccination program. Anything to add?
No, I agree with Clayton. I think my experience speaking with the veterinarians is that most of the time, if a second dose happens, is a rescue dose and not like something that's stipulated from the beginning.
Good. Gracias por la pregunta. 4 minutes, 5 minutes left. We can get 2 more, right? First one. ¿Algo desde la audiencia? ¿No? Voy con el... si está vacunando con una vacuna viva con buenos resultados reproductivos, ¿qué espera al poner otra vacuna viva distinta en la línea? ¿Por qué usarla en el sitio 1 si los resultados son buenos con la actual? ¿Habría problemas de recombinación? So this is a question, I believe, around I'm using a modified live vaccine in my sow herd, but I'm deciding, and we can discuss that, to use a different strain of MLV for my growing pigs. And why would you use that if the results are good in the breeding herd? Am I risking recombination challenges or issues?
So, just to repeat, if I'm understanding right, I think I am. If the question is, I'm having good results in the breeding herd reproductively with modified live vaccine that I'm currently using, but there's a question to use a different modified live vaccine in the growing pig.
Yeah.
Okay. Should I? Is there advantage or is there a benefit, or why should I do that or think about it? I'll start here, and then I'm open to anybody else's comments. This was a question that we got both as a technical team and a research team in the U.S. many years ago, that as new modified live vaccines emerged under the marketplace, if I have pigs being sourced from a vaccinated sow farm using vaccine A, would I have better protection using a different modified live vaccine, especially if I'm vaccinating in the face of some maternal immunity with modified live vaccine B? And the answer to that question, following studies, is no. I mean, they will both work, in the offspring, but there's no advantage of changing the vaccine. There's no, there's not better protection, no enhanced cross protection. Both vaccines will work, and using the same vaccine in the growing pig as you're using in breeding herd makes most sense, so you minimize any risk of having a different vaccination status within and between systems.
Well
Clayton
said.
agrees?
Well said.
Everybody in agreement?
Spot on.
I think in general our objective is to reduce the number of strains, right? So I mean, I know colleagues in practice have tried mixing, even in the breeding herd, 3 or 4 different modified live strains. There's no proof that that generates broader protection. You're just introducing another virus, right, into that mix. Good. Marcelo, another question for you in a PCV2 PRRS combination. Tomando en cuenta la importancia de la combinación de PCV2 y PRRS a nivel de impacto clínico, ¿sería necesario considerar en un brote de PRRS medir la prevalencia de PCV2 en lechones y vacunar en sábana, me imagino que las madres, para minimizar el impacto en la línea? Do I need to translate? Basically, we know PCV2 and PRRS are synergistic and cause severe clinical disease. If we're going through a PRRS instability, we can first, should we measure what's happening with PCV2, and then should we intervene for both?
Yeah, I think if you follow like that framework we presented here earlier with the 5 steps, right? If you are detecting that you have issues, especially early on, you're already vaccinating your piglets at 3 weeks of age, but you're passing through the situation where you're having maybe instability in your breeding herd, and you're having reproductive issues, and you're seeing PCV2 leaking through as well, and infecting pigs very early on in life, or some vertical infection from the sow to the piglets. I think a whole herd approach with sow vaccination is something that could be considered, and again, measure your results so you see that things are moving into the right direction, right? But I think there's enough research today to show that, one, if you do vaccinate the sows, you will have reduction of vertical transmission and the reduction of early infection of the piglets, and that those pigs are going to be protected on the early stages of their life, and that if you do not vaccinate those piglets for PCV2 early in their life, you should not have issues with maternal interference in that piglet vaccination, right? So I think that's a very valid approach. Is it for everybody? I think it has to be evaluated case by case, but it's definitely a valid approach.
What comes to my mind is a research question, because I don't know that we've looked at if you're undergoing a PRRS outbreak, does the stability for PCV2 get affected? It's logical to think it would, but I don't know if we measured that, right? Where you're stable for PCV2, PRRS breaks, and then you start detecting more PCV2. It's a research question for the Iowa State guys, perhaps.
I wouldn't overthink that one. If I'm already going to go through the cost of vaccinating the pigs and I'm going to use an MLV vaccine and I can mix the PCV2 into that vaccine and the mycoplasma into that vaccine, the cost of the vaccine for a breeding herd specifically for a one-time mass vaccination is very negligible. Yeah. I honestly wouldn't even spend money on investigating the PCV2 stability part of it. I would say, let's go ahead and vaccinate for PCV2. If it is a problem, we have crossed it off the list. If it wasn't a problem, in the grand scheme of things, we didn't cause any problems.
And Clayton, since you have the microphone, you have experiences doing this Sabana, this whole herd vaccination for PCV2 and demonstrating, right, the processing fluids really go negative for a long period of time, and that way you silence the clinical expression in the herd, in the whole herd too.
Absolutely.
So it works, right?
It's just using the basic principles of population disease management. If we have instability for PRRS, hopefully we're closing the herd. If we're going to close the herd, let's bring the immunity level for all the endemic pathogens up the herd, up as high as we can. And then we suppress the actual transmission within the herd throughout the herd closure.
Clayton, you said it better than I did. Thank you. Quick one. Oh, no, we're out of time. Sorry. The clock tells me, and lunch, and my belly tells me. Se nos ha acabado el tiempo. El reloj me lo dice y también mi estómago. Vamos a parar para comer. Quiero agradecer a todos los ponentes. I want to thank all the speakers for being here. Thank you.